Mrs. Gibson.
Hello.
I'm Debbie Gibson. I'm a nurse practitioner student with Purdue Global, and I was going to do a few assessments on you today, if that's okay.
Yes.
Okay, I'm going to do a thorax, a lung, and a cardiac assessment.
Okay.
Can I call you Charlotte?
Yes.
Okay. All right. Let's get started then. Okay. Okay, so first thing that I'm doing is I'm just assessing the whole picture. So I'm looking at your chest, I'm looking at the rate of breathing, how you're breathing, the depth of your breathing. You're not short of breath, you're not showing signs of using your abdominal muscles to breathe. There's no cyanosis in your lips. I don't see any cyanosis in your nail beds. No extra strength to breathe, no negative breathing. So, and you surely don't look like you're having distress. So that's how I'm going to do the first part. And then next, what I'm going to do is I'm going to look at your posterior back, and I notice no moles, no wounds, no visible masses, no bruising, no deformities. Is it painful anywhere to touch?
No.
Okay. Okay, so what I'm going to do first is I'm going to ask you to say the word 99 over and over while I'm touching your back. I'm feeling for vibrations, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. All right. And now what I'm going to do is I'm going to percuss through your lung fields, listening for sounds. I want to have a nice resonant sound, which is what a healthy air-filled lung would sound like, okay? So you just breathe normal. Okay, and now what I'm going to do is I'm going to percuss in this area for your diaphragmatic excursion. Okay.
Mm-hmm.
Okay, good. It's about this area, about 4 centimeters, so that's good. Okay. So now what I'm going to do is I'm going to listen to your breath sounds, and you just breathe normal. Okay.
Okay.
Nice deep breaths. Fill them lungs. Okay. Okay, now I'm going to put my hands under your 10th rib. And when I get them under your 10th rib, I need you to just take 2 really deep, full breaths, okay?
Okay.
All right. Go ahead. Great. So your posterior chest wall expansion is symmetrical and adequate. So what we're going to do now is we're going to start with your anterior chest. So if you would like to climb into the bed, we'll do that from here. With a little box to stand on. Okay, put that over there. How's that? Okay. So again, I'm going to assess your chest. I don't see any wounds or bruising, no visible masses, no abnormalities, no deformities, and things like that. And is it painful anywhere?
No.
Okay. Okay. All right. So now I'm going to put my hands there again. I want you to take 2 deep breaths, okay?
Okay.
Okay. Great. So your anterior chest wall expansion is adequate and symmetrical as well. So that's good. So what I'm gonna do, we're gonna do kind of the same thing that we did on the back. I'm gonna just feel around for certain vibrations, and I need you to say 99.
Okay.
Okay.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Okay. So now I'm going to do the same thing with the percussion and just listen for the resonant sound. Okay. So you just breathe normal. Okay, so now I'm just going to listen to your lung sounds.
Okay.
Great. Okay, and the last thing, I just need you to sit on the side of the bed. And what I'm going to do is when I put the stethoscope on you, I need you to say 99 over and over, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. This time I need you to say E, E. Okay.
E, 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 E.
Okay. And then the last one, I need you to say 1, 2, 3, but I need you to whisper.
Okay.
Great. Okay. So that is your negative for egophony, bronchophony, and prolificry, which are abnormal sounds, and you don't have those. So, okay. So I'll have you lay back again, and what we're gonna do is we're gonna look at your carotid arteries. I'm gonna look at your brachial artery and your jugular vein, venous pressure. Okay.
Okay.
All right. Okay. Okay. This sternomastoid muscle has the jugular vein over this side and the carotid artery on this side. And I can see your carotid artery going. Okay. All right, so what I need to do is I need to measure. Okay. From the highest point to measure the jugular vein pressure. Highest point, so. Okay, and that is 3, good. Okay. so what I'm gonna do is I'm gonna listen to your carotid artery, and I need you to hold your breath when I do that.
Okay.
Okay, you can let go. And now I'm gonna do it on the other side. Okay, good. Now I wanna listen to your brachial artery. Okay. Okay. All right. And we decided you had no pain, right?
Yes.
Okay. All right. So I'm gonna listen to your heart sounds, and I'm gonna listen. Starting. Well, let's look. Let's feel for your apical impulse, or your apical pulse, which is the maximal point of maximal impulse. It's at the base, or the base of the heart is here, and the apex of the heart is here, and so the apical pulse is right down in here. I can feel it. If normally, if I couldn't, I would have you tip to the left a little bit, so it would bring it closer. But I can feel it. Okay. All right. So now I'm going to listen to your heart sounds. We have two normal heart sounds, S1 and S2. S1 is usually heard down by the tricuspid valve and the mitral valve, and S2 is heard louder by the aortic valve and the pulmonic valve. Okay. So these are in the aortic and the pulmonic are in the second intercostal space. That's where I'm going to start. And you can just breathe normal. And then I'm going to move to the third intercostal space at Erb's point. The fourth intercostal space at the tricuspid valve. And the fifth intercostal space for the mitral valve. Okay, everything sounds great. Do you have any questions?
No.
Okay, if you want to get dressed, and you can come out and see me and we'll talk.
All right.
All right, thank you for coming in.